Welcome back. You're watching The Full View. Well, the South African Human Rights Commission says that the state of healthcare in Limpopo is deplorable. A fact-finding mission to the province found, amongst other things, that aging infrastructure was hindering the delivery of quality healthcare. The South African Human Rights Commission chairperson, Advocate Bongani Majola, joins us now via Skype for more on this. A very good evening to you, Mr. Majola. We thank you very much for your time. Your initial find to the hospital in your fact-finding mission highlighted, or rather termed to be highlighted by medication and staff shortages. Take us through your experience of what you saw.
Well, good evening and good evening to your listeners. As you rightly say, we found that the hospitals are actually hamstrung by a number of challenges. And these challenges make it difficult for them to dispense healthcare to their patients as required under the Constitution. For example, we found that most of them are complaining about the shortage of staff. Even though the Department of Health itself in the province has the numbers, it appears that a number of the people who are employed there do not have skills that match the required skills for delivering health care to patients. And then with regard to medication, the problem of the shortage of medication still persists, partly because of the confusing ordering system and the fact that part of the ordering system is controlled nationally. And when the tenders expire and they are not renewed, the province remains then hamstrung and has to buy medications on quotation, and often they find that this causes delays. Patients do come and they are told that the medication is out of stock. We were given a number of types of medications that were said to be out of stock. The infrastructure is also a problem because many of these hospitals are old. There has been no renovation or expansion in almost all of them that we saw, because currently National has promised them to build them new hospitals. And so they are not allowed to expand, but National is not ameliorating the deterioration that naturally the hospitals are experiencing. They are cramped. Some of them have leaking roofs. In Tilizini Hospital, for example, you don't have a ward for children who are having psychological problems, so they are admitted with adults risking the abuse and so on. In one hospital, we also found that due to the shortage of staff, the hospital was very dirty. And when we spoke with the CEO, he said it's because he doesn't have the staff. Hello?
Hi, Mr. Majola, are you still there?
Yes, I'm here.
Oh, okay, great. We just got out of a connection there. So in terms of some of the challenges you've mentioned that have come to the fore, particularly around human resources, have you been able to actually engage with provincial government on your findings of what you've seen? We have seen a comment from the provincial health spokesperson, Mr. Neil Shikwambana, saying that the department at this point in time is unable to comment on the South African Human Rights Council Commission's official report until it has actually been released. So what has the dialogue been between the two parties?
We have met the MEC and as well as Premier, and we discussed the issue of human resources with them. And they do admit that there's a problem in the program. And as I said earlier, the problem is actually that they have the numbers, but I think there is a mismatch between the skills that some of their staff members have and the required skills that would enable them to impact on the patients that they have.
And
go ahead.
Continue, Mr. Majola.
I was saying that it is not that we are going to issue a report, as the spokesperson said. We told the MEC that we will go back to Gauteng and we will then generate a letter to them, because we were speaking orally and we would like them to know each and every important issue that they need to attend. So we're going to generate a letter confirming our discussion and adding the fuller details to the letter so that they can then use that to respond to the challenges that we highlighted.
Just very briefly, in accordance with this statement from the provincial chairperson, they seemingly seem to say that, to their knowledge, everything seems to be fine. So were they, in fact, in any way surprised by some of the findings that you had brought forward on your mission to the hospital?
I'm actually surprised to hear that the spokesperson said everything seems to be fine, because he was at the meeting with the Premier, with the MEC, and when the MEC admitted that, yes, things are not right, but they are working to correct them. And he didn't raise this with us during the meeting. Of course, things are not fine in these hospitals. I mean, if you go to the Messina hospital, you will see the hospital is dirty. You'll find water, leaking in many parts of the hospital, running all over. You'll find dirty laundry. We found the kitchen being dirty, not having been cleaned. We went to the pharmacy, and the staff in the pharmacy told us that the pharmacy gets cleaned maybe once a week, if at all. So what he says, I don't think that it's correct. In fact, his boss admitted that problem exists.
All right, we're going to thank you very much for your time as well as your comment. South African Human Rights Commission Chairperson Advocate Bongani Majola taking us through his visit to one of the hospitals in Limpopo as they focus on the healthcare sector.